Hello, my name is Samantha and this is Daniel, and I'm going to be conducting a chest and lungs assessment. First, I'm going to start by inspection. So, I'm going to look at his skin, looking for any nodules or masses. Push your fingers and raise up your shirt. The skin is normal in color. I do not note any cyanosis. I'm checking his lips and his nail beds. There's no cyanosis, there's no clubbing. His chest is symmetrical. The mid-sternal line is vertical and the angles of the ribs are appropriate. I do not see any deformities. The clavicles are prominent superiorly in a good angle. The angles of the ribs are within normal limits. He does not have a barrel chest, which could indicate chronic asthma or emphysema. Whenever I check his AP diameter, I see that the diameter of the chest is less than the lateral diameter. Now, Mr. King, I'm going to be assessing your pulse, please. Okay, Mr. King, your pulse is 64 and your respirations are 16. I checked his pulse. It was regular. I checked it for 30 seconds, and then the remaining 30 seconds I was checking his breathing to make sure that we were going to be getting an accurate measurement. His ratio to the respirations is 1 to 4. The chest expansion as he breathes in is symmetrical. It's easy for him to breathe. I don't see any nasal flaring. He doesn't appear to be in any distress. His breath is even. It's not shallow or it's not too deep. He's not using his accessory muscles. I didn't notice any pulsations or bulging or depression when checking his thoracic area. Next, I'm going to check his trachea. I'm going to find his trachea. I'm checking to make sure that it is midline. There's no tugs, and the trachea is midline. Next, I'm also going to find, there we go, thank you, his suprasternal notch, and then the angle of Louise, and then his costal ribs. Checking his back, I didn't see any kyphosis, any scoliosis. Noted there's no venous patterns on his chest, which could be for cause of concern. As I was palpating, I didn't feel any crepitus, which can indicate air under the skin. There was no tenderness, mass, or lesions as I was palpating. I didn't notice any retractions, which occur whenever a patient's in distress. I didn't see any paradoxical breathing, so that's normal. I'm going to be placing my hands on his back to palpate the thoracic expansion. Alright, Mr. King, I'm going to pick up your shirt and I'm going to kind of get down a little bit. I'm going to place my fingers at the level at about the 10th rib. And Mr. King, I need you to take a deep breath in. Very good. And it was, the movement on both sides was symmetrical. Okay. Now I'm going to place my hand on your back, and I'm going to ask you to say 99. So go ahead.
99. 99.
And one more.
99.
Okay. It is symmetrical. As I go down his back, I do feel the vibration. I'm also going to do the same in the chest.
99. 99. 99.
Very good. Thank you. And checking with this, I feel the palpable vibrations in both the front and the back. If it was decreased, there might be excessive air. If it was increased, it could indicate a possible presence of fluid or a solid mass. Okay, now I'm going to check Daniel's diaphragmatic excursion. I'm going to pick up your shirt. And Mr. King, I'm going to have you lean over, please. Let me grab my pen. Okay. And I'm going to percuss his back until I hear an area of dullness. I'm going to be using the direct method. And when I start hearing the dullness, I'm going to put a mark. And then I'm going to have him inhale, hold his breath, continue percussing until I hear dullness. And then I'm going to measure it, and I'm going to do the same on the other side. So Mr. King, go ahead and take a deep breath and exhale. Okay. Go ahead and breathe, Mr. King. Okay. Now I need for you to take a deep breath and inhale. Alright, Mr. King, go ahead and exhale. Very good, thank you. Now I'm going to have you do it again. Alright, ready? Take a deep breath and exhale. Okay. Thank you, Mr. King. And Mr. King, I need you to take a deep breath and hold it. Good. Thank you. Alright, Mr. King, go ahead and breathe regularly. I'm just going to measure. Okay. And we have 4 centimeters, which is normal, and 4.5 centimeters, which is also normal. Very good. Thank you very much. Oh, sorry, got your shirt all tangled up. Okay. Now, Mr. King, I'm going to have you raise your arms, and I want to percuss the front of your chest and the lateral portion, okay? I just want to see where the air. Okay, I'm going to be using the direct method. So about here. Okay. Alright, Mr. King, you can go ahead and relax. Sorry. Okay. Very good, thank you. And I heard resonant tones that have a loud intensity, some were low in pitch, and long in duration and hollow quality. Next, I'm going to check his vocal resonance. I'm going to put my stethoscope up to his chest and his back, and I'm going to have him say 99. I'm going to start medial, and then I'm going to extend out laterally. And my expecting finding is that it becomes less distant as I go away from the center. Okay. Mr. King, when you feel my stethoscope, will you please say 99?
99. 99. 99. 99. 99. 99. 99. 99.
Very good. And can you please whisper 99?
99. 99.
Are you whispering?
99.
Okay.
99. 99.
Okay, very good. Now let me go to your chest. Okay.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, very good. Now I'm going to have you whisper, Mr. King, okay? Thank you. Okay, the sound of the patient's voice did become less distant with auscultation as I moved peripherally away from the midline. Okay, next, normally we would be doing the difference between exercise and respiration rate and arresting respiration rate. Now, for time restrictions, prior to this assessment, I did have Daniel do jumping jacks. His respirations were 16 before. After exercising, 5 minutes afterwards, his respirations were 18. So that's really good. Next, I'm just going to listen to his lung sounds. I'm going to start in the front chest, and I'm going to listen to 6 spots, and then I'm going to move to his back and determine what his lung sounds are. Okay. Mr. King, whenever I touch my stethoscope to you, I just need for you to take a deep breath, okay? Let me know if you get dizzy. Okay, deep breath. Very good. Very good. Very good. Very good. 2 more. Very good. Very good. How are you feeling? Are you dizzy or anything? No? Okay. Sometimes it can make you kind of lightheaded taking all those deep breaths. Deep breath. Very good. Deep breath. Good. Deep breath. Very good. Deep breath. Good. Deep breath. Good. Deep breath. And 2 more, Mr. King. You doing okay? Okay. Good. And 1 more. Good. Okay. His lungs are clear. They're equal bilaterally. I did hear clear lung sounds on both sides. There was no advantage sounds, no crackles, rhonchi, wheezes, friction rubs, or pericardial rubs. So, Mr. King, I think that conducts our lung and chest assessment. Thank you very much.